Coming up this week on Talk with Audrey, Dr. Talia Kaden is an ophthalmologist at Manhattan Eye, Ear, and Throat Hospital. She has some tips to help you prioritize your eye health. We're also going to talk about age-related macular degeneration and the newest treatment options for wet AMD. Dr. Liana Tsikitis Fellow of the American College of Surgeons joins me to talk about why screening for colorectal cancer is vital and why all adults, including those under 50, need to remain vigilant about screening. And if you don't know what to make for dinner, I have Chef Jamie Gwen with her go-to quick meals for families on the go. It's all coming up this week on Talk with Audrey. Insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll be right back. You're watching Talk with Audrey. Welcome back. Millions of people in the U.S. live with eye conditions that can cause blindness if left untreated. One of the most common causes of vision loss later in life is age-related macular degeneration and wet AMD, an advanced form that can cause severe and rapid vision loss, but it can be stopped or slowed if caught early enough. My guest today is Dr. Talia Kaden. She's an ophthalmologist at Manhattan Eye, Ear, and Throat Hospital, and she joins me now with some tips to help you prioritize your eye health. We're also going to talk about some of the treatments for wet AMD, including the newest options available to patients. Welcome.
Thank you so much for having me.
Well, I've heard a lot about age-related macular degeneration, but what's the difference between AMD and wet AMD?
Sure. So as you mentioned, age-related macular degeneration is a very common disease. It impacts over 20 million Americans. And of those 20 million, about 1.5 million have what's known as wet macular degeneration. So what that means is that, the retina is the back of the eye. It's the part of the eye that allows us to see it. We always describe it as the film in the camera. And the macula is the central part of the retina. It's the part that allows you to see really fine details and allows you to read. And when we have wet macular degeneration, there are abnormal blood vessels that can form in the macula. And these abnormal blood vessels can leak and they can bleed and they can cause permanent vision loss.
So it's sort of like a film over what you see, or does it also distort your vision?
So that's a great question. In terms of the symptoms, they can be pretty broad. So it can be things like just general blurry vision. It can be difficulty driving or watching TV. Or it can be that straight lines start to look wavy. So if you're looking at the tile in your bathroom or you're looking outside at a flagpole and you start to notice that these straight lines don't look quite so straight, that's a reason to go and see an eye doctor immediately, because macular degeneration, and particularly wet macular degeneration, is something that if caught early, if treated early, can really help to preserve and save your vision.
How is wet AMD treated?
So wet macular degeneration is treated with an injection of medication inside the eye. And this medication can be given anywhere from once every month to sometimes every 2, 3, or even 4 months. The most recently approved medication is a medication called Vabysmo. But as with every medication or treatment, we always recommend that you talk to your doctor, to your eye doctor in particular, about what the right medication and treatment option is for you.
And it slows down the progression of wet AMD? Can it completely get rid of it?
So you can't get rid of it entirely. And that's part of the reason that you need to continue these medications, that you can't just give it once. I always tell my patients, this is unlikely to be a one and done. You will have to have an injection. And just like taking medication for your high blood pressure or for your heart, it's something we're going to have to do regularly for a long time. But the medications can really help to preserve your vision and maintain good vision.
Well, is there anything that we can do to prevent it?
Well, some things we can't avoid. So as you mentioned, it's age-related macular degeneration, and it's more common in people over the age of 60. So we can't do anything about that. And it is more common in women. But it's also, some risk factors include things like smoking or high blood pressure or even being overweight. And so in those cases, those are modifiable risk factors. Those are things we can change. And so as much as you can, if you can stop or avoid cigarette smoke, that's great. Eating lots of green leafy vegetables is helpful. And then finally, making sure that you're seeing your eye doctor every year, especially if you're over the age of 60, And that if you're noticing, or if someone you take care of is noticing, that their vision is changing in any of the ways I described or in anything else, you really want to make sure you see your eye doctor immediately. Because again, early detection and treatment can be very helpful in this disease.
I'll tell you what, we really do have to be on top of things as we age.
Yeah, it's true. I know you got to see your dentist and your eye doctor. It's a lot to do, but honestly, it really is so important.
Indeed. Your vision is very important. So guys, don't forget to see your ophthalmologist every year at the very least. And like the doctor said, you have to be sure that if you notice any changes at all in your vision, anything at all, get to the doctor, because there are options if caught early. Where can we go, Dr. Kaden, for more information?
Sure. So if you're interested in more information about the medication I mentioned, you can go to vabysmo.com. If you want to learn more about macular degeneration and the symptoms and treatments, I always recommend the American Academy of Ophthalmology, or AAO.org, or the American Society of Retina Specialists, ASRS.org. Both of these are wonderful websites. They have a lot of great resources. They even have things you can print out and share with your family, and they give you more information about the disease and symptoms and treatments.
Dr. Talia Kaden has been my guest. She's an ophthalmologist at Manhattan Eye, Ear, and Throat Hospital. We've been talking about age-related macular degeneration and wet AMD. It can be stopped or slowed if caught early enough. Take charge of your eye health and check with your ophthalmologist and/or healthcare provider. Thank you so much for joining me.
Thanks for having me.
And I'll be right back after this. You're watching Talk with Audrey. Welcome back. Colorectal cancer is the third most common cancer diagnosed in the U.S., excluding skin cancers, and it's the third deadliest. The disease impacts families every day in every part of the country, and it's increasing in incidence among young adults younger than 50. But fortunately, colorectal cancer is often preventable and highly treatable when caught early. Joining me today, Dr. Liana Tsikitis Fellow of the American College of Surgeons, and we're going to talk today about why screening for colorectal cancer is vital and why all adults, including those under 50, need to remain vigilant about screening. Welcome.
Thank you for having me, Audrey.
Thank you for joining me. Who's at risk for developing colorectal cancer?
So everyone is at risk of developing colorectal cancer. We have about 6% lifetime risk for developing colorectal cancer. Certain persons, of course, that have family history, they have a higher risk for developing colorectal cancer, or persons that have genetic syndromes that predispose to colorectal cancer.
How does it develop?
So every growth starts with few cells, and they grow to form first a precancerous growth, a polyp, we say, an adenoma that easily can be removed with colonoscopy. So our screening test can remove it before it becomes a cancer. And then when it's not attended, that growth is going to grow within itself, and a lot of cancerous cells will be developed and eventually can grow to close the pipe, the large intestine, to obstruct, or to go to, the cells may migrate to other organs like the liver and the lung when it gets to advanced stages.
And what are some of the signs and symptoms of colorectal cancer?
The early stages of colorectal cancer or the polyps are not symptomatic. They don't cause any symptoms. That's why it's extremely important to get screened when it's indicated. When it's more advanced, we start seeing changes in bowel habits, that they're persistent and consistent. We see rectal bleeding. Certain patients complain of unintentional weight loss and abdominal pain.
So checking with your doctor is going to be important, and getting screened is also important. What are the screening guidelines?
So the screening guidelines actually recently changed to start screening at age 45. We are seeing an early onset. We're seeing colorectal cancer in the young. And unfortunately, the young are the ones also that come with advanced stages. So the screening guidelines changed to start at age 45. But I want really to alert everyone, if there are symptoms like the ones I mentioned, to definitely be brought up with their primary care provider and seek the next steps.
Doctor, why do you think colorectal cancer is being diagnosed in younger people? Is it our diet? I mean, what's going on?
It's a great question, Audrey. We really don't know. We do believe that diet may play a role, but it may not be just diet. Environmental agents. Overall, there are some changes that we see. A lot of people believe that it can be behavioral habits as well. It's very hard to really say what exactly it is, but definitely it's real. We're seeing it every day.
Well, we've talked about who should be screened and at what point. Let's talk now about some of the screening options that are available. Everyone knows and has heard about the colonoscopy, but it seems like people maybe aren't going to get a colonoscopy because they're afraid.
Yeah, and what you're saying, it's very true. So we have few options for screening. We have stool tests. And within the stool test, there are two of them that are commonly used. One is the FIT test that checks the hemoglobin of the individual, the blood count in a way, in the stool of that particular person. And then we have another stool test that can test tumor cells if there is a tumor in the person, as well as their hemoglobin. Both are pretty sensitive. The FIT test is about 80% sensitive to pick up, cancers. The colonoscopy is the gold standard. There is under the endoscopy umbrella, we have also flexible sigmoidoscopy, which it's a shorter, in a way, colonoscopy. One could think that we are only examining the left side of the large intestine. When my patients say I'm very fearful to undergo colonoscopy, as a physician, I find that it's my duty, my role, in to delineate why they are fearful and try to reassure them. Some may be the prep, and there are many preps now in the market that we can make it more palatable for our patients. And some is maybe the actual procedure and why they're fearful. So with moderate sedation, the procedure is very safe. And most importantly, it saves lives. And it's the best screening tool we have right now. So again, delineating where the fear is coming from and having that discussion with your patient, I think is necessary when that fear arises.
And do you think that people are embarrassed? I mean, after all, it's pretty personal.
Yeah, no, absolutely. Definitely a little bit of taboo issue, not a dinner conversation, as I say, but it's part of our body. And the fact that we can catch it early, I think the embarrassment, I understand it, but I think through a talk with the patient, maybe it can be reassured and it can be alleviated. That's how I usually approach it. You're right. Embarrassment. I really applaud all celebrities that have gone on screen saying that they're getting their colonoscopy and normalizing it, because it is part of our body.
Indeed it is. And if you want to be healthy, well, you got to do what you got to do in order to be healthy and to find out if you're healthy. And that means getting checked. What advice, doctor, would you give to someone who's reluctant to get screened?
Well, first I would start with the fact that we can quote the rates of cure when you catch a polyp and you get the polyp out, you have prevented a possibility of that polyp becoming a cancer. So it's the best news. But when you catch it early, like early stages of colon cancer with surgery alone, you can have a cure rate over 90%. And then on the other hand, a survival and prognosis with advanced stages is not as great. So that is one, I think, argument. Again, if they are reluctant, delineating why they're reluctant, the prep, I may, work with them in figuring out what the best bowel preparation would be to have a successful endoscopic exam. A lot of patients will complain about that. And then the actual procedure, I go over with the procedure and with the patient beforehand, try to make it easier for them, understanding of what they're going to, what the screening would be, what it will be entailing.
And how often are the screenings recommended? Is this something yearly, every other year? What's the timeline?
Yeah, Audrey, it depends on the screening test that we order. So with colonoscopy, if we find no polyps, then we'll say 10 years interval. It's the best news. A lot of the patients give me the thumbs up after a colonoscopy. Oh, no polyps, 10 years. But with the stool tests, the FIT test will be a yearly exam. The other stool tests that I mentioned that also test the tumor cells, if there are tumor cells, it's every 3 years. So it does depend on the screening modality that the physician has ordered. Again, it's a discussion between patient and physician of what the best test may be for that particular person.
As always, be sure to speak with your doctor or your healthcare provider about what's best for you in your circumstances. Where can we go, Dr. Tsikitis, for more information?
So for more information, definitely first the primary care office is, I think, the best way to get all the information one may need. But if they happen not to have a primary care provider and they want to learn more, I mean, going through the internet, you can go through the guidelines from professional surgical societies. You can go, or even like typing screening guidelines for colorectal cancer, CDC guidelines will come up. A lot of other guidelines will come up, and people will be able to find. But I always urge everyone to have this discussion with their primary care provider.
Screening for colorectal cancer is vital, and all adults, including those under 50, need to remain vigilant about screening. Dr. Liana Tsikitis Fellow of the American College of Surgeons has been my guest. Thank you so much for joining me.
Thank you for having me, Audrey.
My pleasure. There's more to come on Talk with Audrey after the break. Welcome back. A recent survey revealed that 94% of us are looking for food options with a longer shelf life. And at least once a week, frozen foods have bailed out almost 77% of us during that last-minute what's for dinner conversation. My guest today is Chef Jamie Gwen, and she joins me now with her go-to quick meals for families on the go. Hi, Jamie.
Audrey, so glad to be back with you. Thank you. I love being bailed out, just so you know, for the record, by the frozen food aisle, because I am a fan and I love statistics. I love what you mentioned. There is this most recent survey that's fascinating to me by the National Frozen and Refrigerated Foods Association that says 73% of parents with a child under the age of 17 living at home say that the time after school and before dinner is the most hectic time in their household. So talk about bailing out. It's March Frozen Food Month to the rescue.
Well, I'll tell you what, there's nothing like going to that freezer and being able to pull out something to cook. Frozen foods are obviously helping to create healthy meals. What are some of your tips when it comes to shopping for frozen foods?
Sure, of course. I love the word easy. It's lovely, isn't it? And I love that you said it, because I think for those that might not have embraced the frozen food aisle yet, March is the month to do so. But to look at how progressive, how far the frozen food section has come. Frozen foods are convenient. They simplify meal prep. And as a professional chef, I can tell you, if someone else does the peeling and chopping, I am very, very happy. So save time in the kitchen, explore the frozen food aisle, and you'll see that a lot of the work can be done for you. March being Frozen Food Month is the perfect time because the deals are really, really good. But I'll also mention to you, I think it's a time to explore, right? Because there's so many ethnic flavors. There's so many fabulous, high quality items in the frozen food section.
Well, that makes it easy, right? Definitely. So it's not just frozen meals that you can get, but you can actually buy frozen vegetables that can turn into meals.
Exactly. And so here's the thing, Audrey, when the frozen food industry began 40 years ago, we're celebrating 40 years this month. They were just meals, like you said, right? Compartments all put together. Today, if you buy frozen berries in the frozen food section, They are flash frozen, and that technology has been around for a while, but it is better than ever. So today's flash freezing technology means that they're picking the produce at the peak of freshness. They're locking in all those beneficial nutrients. The food stays fresher longer. You get a longer shelf life and ultimately less waste, which is wonderful. But you also get the best value. So my Brussels sprouts, already cleaned, cut, and halved, come from the frozen food section. That's where I get my Brussels sprouts, and they're in my freezer right now. I love that the frozen food aisle has become so progressive that expert chefs, friends of mine, are designing and developing recipes for big companies. I think what's most important to remember is that frozen food is real food, real ingredients. It's a great shortcut, as you alluded to many times, for prep. It's a great meal replacement if you don't have time to make a chicken dish and put it on the table. And then it's a great way to taste new things, which I love.
So Jamie, share some of the new recipes to help families plan cost-effective meals using things from their own freezer.
You know, I wouldn't come without new recipes. All of these recipes are new. They're mine, and I'm very proud of them. And they fit every lifestyle, as does the frozen food section. So whether you eat plant-based or vegan, if you're going lean and clean, if you're protein packed, you'll find all of those things in the frozen food section. One of the things I love about the freezer aisle is that its heat and eat options are great as well. So this is a breakfast board that I like to put out. Something that I love so that I can pour a second cup of coffee and sit down myself. But you can feed a crowd on a board or a platter or a tray with waffles, multi-grain options of pancakes of every flavor, sausage and biscuit sandwiches, burritos, and more. And then I add a personal touch by making 2 homemade sauces, my creamy chipotle sauce and a homemade blueberry syrup or a berry syrup using frozen berries. And I'll tell you, this is the most leisurely, lovely Sunday breakfast board ever. Now for dinner, this is a one-pan wonder. My roasted pierogies with caramelized onions and Brussels sprouts are made in one pan, and it's hearty and it's delicious, and my son loves it. Mediterranean inspired. This is for the protein lovers. I love cauliflower gnocchi from the frozen food section. If you haven't had them, you have to try them. I mixed them with my favorite turkey meatballs. I made a homemade creamy tomato sauce. And I'll tell you, it is out of this world delicious, and the leftovers are fabulous. This is my newest addiction. I have a thing for Asian food. I crave it. And so I took 2 things that I love. I love the concept of a lettuce wrap, and I filled it with orange chicken. Doesn't get any better than that. A homemade sauce, some fresh scallions on top, and you really have a delicious lunch or dinner that comes together in no time. And then last but not least, something sweet, of course. This is my blueberry trifle cup. It's all about balance and texture. So you've got this homemade blueberry compote. You've got pie dough from the freezer section that gets cinnamon sugared, baked off, and crumbled. So you've got great crunch. And then you've got Cool Whip on top, and you layer them and store them in the fridge. They're a make ahead. You pull them out when you're ready for dessert. They only get better with time. And then don't tell anybody, but the next morning I eat the leftovers for breakfast.
Oh, I love the frozen food aisle. Where can we go for more recipes? And I also hear that people can enter for a chance to win $10,000 in prizes.
Yeah, amazing, right? There is a sweepstakes in March from the National Frozen and Refrigerated Foods Association. $10,000 in prizes. I am not eligible. I hope you win. And you want to go to easyhomemeals.com, easyhomemeals.com. All the recipes that I mentioned are posted there now. So please steal them, make them, call them your own, and explore the frozen food aisle. There's really fabulous stuff, truly.
Absolutely. I'll tell you what, guys, you'll never look at the frozen food aisle the same. I gotta tell you, Jamie's given us some great tips, so check out that website. Jamie, thanks so much for joining me.
Audrey, thank you for having me back. Thank you, thank you.
And that's it for this week's show. I'm Audrey Adams. Join me here next week for more insightful, intelligent, and inspiring conversations and information on Talk with Audrey. It's all about the business of living. I'll see you next week.